Welcome to the SEEK webinar on school reopening. SEEK is an organization of parents, providers, attorneys, and advocates who advocate, educate, and legislate on behalf of children, students with disabilities. Tonight, my colleague Jennifer Laviano and I will moderate a discussion of some very well-informed people on what school opening could and should look like. As far as we know, there are no detailed plans that have been developed, or frankly, are really in the works. The governor wants to hold off as long as possible to gain more health information before making a decision about school in the fall. This, of course, has put local school boards, boards of education, teachers, and parents in a very foggy place.
Tonight's session will be very interactive. Andy and I are going to pose some topics and ideas out to the panel, and then we're going to ask you to jump in, including on each other if necessary, with what you think sounds good, what you think sounds bad, ideas moving forward, problems that you may see, but we hope some solutions. This is sort of a brainstorming session among all of us. And so I'm going to introduce the panel, and I'm going to ask you to wave if you can when I announce your name. And we are thrilled to have all of you with us tonight. Jan Peruccio, who is the Superintendent of Schools in Old Saybrook, as well as the Treasurer of the Connecticut Association of Public School Superintendents. Thank you, Jan. Dave Scotta, who is the Executive Director of CONCASE, which is the Connecticut Council of Administrators of Special Educators. Patrice McCarthy, who is the Deputy Director and General Counsel of CABE, which is the Connecticut Association of Boards of Education. Thank you, Patrice. Jerry Fleming, who is a remarkable special education advocate from Norwalk. Thank you, Jerry. And Jeff Leake, who is the President of the CEA, which is the Connecticut Education Association, which is Connecticut's largest teachers union. Thank you all for coming.
So I'll lead off with the first question. Will schools be open for business in September?
Absolutely. One way or another, we'll be open for business. Just as we're open for business in a way right now. Schools are not, school buildings are closed, but we've been attempting to the best of our ability to educate the students in Connecticut for the last couple of months and for the next month or so. So I'm certain they will be open, but I'm not sure what that open word means right now.
You know, the most recent, I think we're starting to get more information as we move on. And will schools be open in the fall? And I have to agree, you know, with Jeff, yes. It just depends on what that might look like. You know, some variations of what's being presented are, you know, doing what we're presently doing, maybe in a different way. Looking at alternative days as a possibility. Looking at, you know, half days as a possibility, but I don't think there's anything really set in stone. I think what we've been seeing is there's information and some guidance or kind of anticipated plans coming out, but nothing set to say exactly what plan is the best option. You know, but yes, I also agree that there will be some form of school in the fall. What that might look like, I think is yet to be determined.
And the one thing we know for sure is that those decisions and those protocols will be driven by a primary focus on the health and safety of the students and all of the staff involved. And that's why there is this uncertainty. We don't have a clear medical answer as to what would be appropriate at the end of August or early September. So districts are looking at a variety of scenarios so that they can be prepared to the extent possible, depending upon what the best medical advice at that point is.
If we reopen for in-school learning, I'm afraid that we may have to close again in the winter. But even if we do open in September, I think that school districts should consider pairing the students with the teacher that they've had this year, so that the teacher will be familiar with the students and remediation can begin more quickly, because we may need to close down again. So we don't have further loss of sort of ramping up, getting to know your students, and then only to have to close again. And I think that the state could start by preparing for that contingency now of having to possibly close again if we reopen, by training teachers and parents to better engage with remote learning techniques, create a repository of a curriculum and methods that were effective during the closure, and creating standards and guidance for school districts to ensure that there's equitable experiences across districts, because right now there seems to be great variety in what kids across the state are experiencing.
I think the only thing that I would add to all of those comments is, while I think that the decision will of course be driven by health and medical concerns, I do think there's a significant amount of pressure, on folks at the state level to move the decision forward to open up our economy. And I know that we in education certainly support that, but our primary goal is to be sure that our staff and students are safe, and that the academic environment that we create for them is the best possible that we can offer. And so what I think schools will look like in August, September, October, whenever it is that we quote open, because I agree with Jeff, we've been open, it may be very different from anything we've ever seen before. And while that's frightening because we're creating all kinds of different plans to prepare for multiple eventualities, I am also beginning to see some creativity coming out of the practice and the process, and teachers and parents and even students working together to generate ideas that are possibly going to create great opportunities in the face of real hardship.
Jan,
One of-
what are
yeah.
let me just
I think-
follow up a little bit. What are the three things that worry you the most about reopening schools for in-school education in the fall?
Andy, was that question for me?
Yeah, that's for you, Jan.
Okay. The three things that worry me the most, well, the sense of responsibility that we as superintendents feel. I think I can speak for my colleagues to keep our staff and students safe. That's number one. That's the first goal that we need to achieve. To quickly assess any learning loss that may have happened, or quickly assess where our students are, not just academics, but also emotionally. And again, that also goes for staff, so emotional well-being. Being prepared to handle and to address anything that we learn through those formative assessments, and then being able to respond in a very flexible and quick way to meet their needs. I think those are the most immediate concerns in my mind right now. The potential for closing back down again, we have had time now to think about how we're going to respond to that. I think those three are the most immediate to me.
I think that social emotional piece is large, somewhat hidden at the moment, but is going to loom very large as we open up. And I totally agree that we can't not just look at academics and the instructional side. We have to look at taking care of kids, being careful about their state of mind, and teachers as well, because I know that so many of our teachers have done the best they can, but have also felt like it just wasn't enough, and they couldn't provide enough. So I think that's going to be something that's there, and we're going to have to deal with that as best we can. I agree. We've learned some things from the last couple of months, but clearly we need to pay attention to the whole child, not just the ABC child.
So I just wanted to jump in on two things, Jerry, and then I'll get to you as well. One is a question came in through the Q&A on the chat about ESY, extended school year services, and whether we'll be open for that. We've been anxiously awaiting guidance from the state on this. The governor has already said that no summer school will begin before July 6th. We know that. So stay tuned. Our Thursday Seek this week, we do an update every week at 7 o'clock on our Facebook Live, and we will certainly cover any updates in this regard. I just wanted to also point out in response to Jeff's point about social and emotional, that we at Seek certainly agree with you 100% on that piece, because we are very concerned about students who have high anxiety. For the students that we certainly work with, our families anyway, and then they're going back to an anxiety producing situation, as well as making sure that all of the educators are approaching this from a trauma informed perspective, since many of our students will be traumatized by this. Jerry, did you want to add to that?
I think just one of the things that I think the crisis has sort of laid bare for us is just how much of a community hub our schools are. And, you know, schools are providing food, they are providing internet connectivity and technology. They provide mental health as well as physical health. You know, there are health clinics in many schools. And with the closure, that has, you know, created all sorts of issues, especially for those who are the have-nots in society. And, you know, to Jan's point, you know, how we want to keep everyone, you know, safe and secure if we do reopen the schools. I think the tension is that schools also are the child care provider for working parents. And, you know, to the extent that we want to get the economy open, we're going to also have to open the schools. And that's where I think, you know, a lot of this anxiety is stemming from.
And I just want to add the other thing that one of the other things that schools provide for our students is real structure in their lives. And we know that that's one of the challenges some of our students have in terms of trying to engage in distance learning, that they are in living situations that don't foster that don't provide a structure for them. And that's one of the things that's really irreplaceable.
Absolutely. So next question is, if schools are limited to no more than 10 people in a classroom, is it possible to educate all of our IEP eligible students in Connecticut? Who wants to take that one first?
There are.
I'll attempt it, I guess. You know, the answer is, well, I'm not sure that there's really let me start again. The answer is yes. I mean, obviously, we have to educate our IEP students. I mean, that's just obvious. You know, how that happens, I think, has to be determined, you know, maybe either at the district level or a building level. You know, as I'm listening to the conversation, I think one thing and it's not missing, but we can't negate the fact that if we're going to do reopenings, we've discussed how that might look. We've discussed maybe having it regional. We've discussed how maybe district-wide there should be planning. But I think part of that integral planning needs to be involved with not only staff and administrators, but families as well. I mean, I think we really have to push out to families to be an integral part of any planning that's happening as schools start to reopen, but at the individual level, whether it's the school building level or the district level. So even if it's limited to 10 kids, that might present a problem, obviously, but that's also been discussed as far as some of the points of reopening and what might that look like. So I think it's just really looking at it and planning. And, you know, the biggest problem that we face with, and Annie brought this up earlier, is that it's really the unknown. I mean, until we have a clear-cut picture of what's going to happen in the fall, schools need an opportunity to plan. And they need an opportunity to have everyone involved in that planning process. And that's, as I said before, and I don't repeat myself, but it has to involve, you know, students, obviously, if they're capable of doing that, you know, staff, administrators, and parents, and part of that process for reopening. And I'll leave it at that.
Well, we've heard a lot about hybrid models. could you all talk about a hybrid model that you think would really work well?
Andy, I think a hybrid model of in-person learning at school with 2 shifts, a morning and an afternoon each day, 3-hour sessions, as well as distance learning, would break up classes into 3 different sections. There'd be a morning section, an afternoon section, and an at-home section. And that would likely satisfy the no more than 10 students rule. The students could be rotated through the sections. And for in-school learning, I would think that the teachers should move from classroom to classroom to mitigate the need for whole room disinfection between classes and to maintain social distancing in the hallways during the class changes. High need students of all kinds can get extra supports in school after or before they begin classes.
Yeah, I think the idea of social distancing is extremely important, and setting up the ability to do that is going to be extremely important. I think we can look at the quote unquote split session idea. I'm not sure that that's the best idea for every age student. It might be for the kids as they get a little older, middle school, high school, perhaps. But the bottom line is the ability to do that, I think, is limited by our ability to kind of think outside the box. There might be ways that we can use spaces that we've never thought of using, for example, to move classes into other areas that haven't been used before. Even perhaps outside of a school building. There are other places in a community that might be places that for now we have to look at and say, we can use this as space for our kids and try to figure out how to do that. But the most important thing that I am concerned about, and I think most of our teachers and administrators are, is we cannot think that we are going to be able to do this well if we have the same amount of resources or less resources than we had when we left in March. If we think that, we're in trouble already, and it's not going to work. For all the things we talked about this morning, this afternoon, the social emotional supports, for example, the making sure that our special needs students are taken care of. We're going to need more supports, not the same or less supports. And that's going to be a tough struggle, clearly, as we make our way through the economic situation we're in right now.
I want to agree with Jeff because we host weekly check-ins with all board chairs around the state where we give them updates and also hear what their pressing concerns are. And clearly the fiscal impact of this pandemic is weighing very heavily on their minds. A number of districts have had 0% increases in their budget. We know that keeping everyone safe and providing that bridge for learning that has been lost over these past several months, even in the best case scenarios for some of our students, helping them catch up, that is going to be costly. As well as some of these hybrid models, if we have students in for half a day and the rest of the students in for the other half, that's going to double transportation costs. That is a huge budget item. So districts are looking at alternatives in some of their communities where they might be able to, as Jeff suggested, educate some of the students in a different setting, a Y, a Boys and Girls Club, some other public facility, and it might be in that child's neighborhood, so we would be able to avoid some of those transportation costs. But for many of our districts, they're completely dependent upon bus transportation to get their students to school.
Just to add what Patrice said, one of the things that came up this afternoon when I sit on the Rusk Alliance Task Force for Reopening, and they talked about some of the different models. And the half-day model is one of the suggestions. But associated with that also was the fact that they anticipate it would be an additional $1,000 per child for transportation purposes was one of the figures that was thrown out if they went to a half-day model because of that. Now, I'm not sure if that's how accurate that is, but that was one of the things that was put out there as far as cost.
So a lot of the questions that are coming through just for the panelists on the chat and the Q&A are about working parents. If schools were to go back with a hybrid model of some type, what if you have a child who's in elementary school and another child who's in middle school? Just for the panelists and all of our participants' benefit, there's an excellent May 15th article that came out from Johns Hopkins. It's called Filling in the Blanks, and there's a comparative analysis of how some other countries have done hybrid models, and there's just a lot of really good data and information in there, but we certainly welcome your ideas about how to overcome some of the challenges with the hybrid models for all students.
I think that I would add to what's already been said that we have watched our economic advisors start by saying that this would be a V recovery, then it was a U recovery, and now I'm hearing it's an L recovery, which I know the shape of an L, and that doesn't sound like a recovery at all. And so that is the fiscal environment that leaders of school districts are going into. And, you know, to run the risk of being a little inelegant, I think in some places there's a cash grab because schools have been shut down since March, so some districts are seeing a surplus in some areas. And I think there needs to be some education for all about, yes, there's a surplus right now, but there will not be a surplus in 21. Any of the three proposed ways of looking at alternative education have significant costs baked into them. And it's just a question of where a district or a region or the state wants to begin to unravel the problem. Is it additional space, and therefore we can put 10 in a class? We can have a hybrid of technology classes, you know, online classes and in-person classes. So maybe there won't be as much cost in staff, but it'll be a space cost and a transportation cost. Or is it transportation cost and half days? And then what do we do, again, thinking of the bigger picture of the economy, what do we do with those parents who have 4 children going to school at different times of day? We can't create academic schedules for family structures, yet we have to consider them. So there's nothing insignificant in any of the costs associated with the plans being proposed.
Do you expect to see any CARE Act money?
We, our district, are getting money, the 80%, I think it is, of the Title I money. But Old Saybrook is not going to be eligible for significant amounts of money. So it's about a little over $100,000 to Old Saybrook. But I would imagine that in some districts, since it's tracking the dollar amount associated with Title I, that there will be more money.
That's right, but there's nothing that specifies that it has to go to the educational enterprise. I mean, there's 12 stated purposes in the act that it could go to, right, that allows the money to be used for any of a broad number of purposes.
Right.
What are you hearing about that, Patrice?
I think that their boards of education and their municipal officials are working closely together where there is good communication. And we know that in times of crisis, that sometimes brings people together. But if there's not good communication to begin with, things can go in a different route. So we also have to remember that in some of our larger districts, they have made huge expenditures to acquire technology for their families that didn't have it when this crisis began. So in many of those districts, there's very little savings even in the current year budget.
I think it goes back to something I said a little bit earlier. I don't think the solution for how we're going to take care of our kids is an all encompassing one. I.e., I think we definitely have to look at doing something differently, let's say at the upper grades as opposed to the younger grades. I'm seeing some things in the chat there. We know that bringing in a second grader for half a day isn't going to help working parents one iota. So for them, I think we have to look at a different kind of solution that maintains that kind of separation that we need, and lowers the class size to make sure that they're not on top of one another. But perhaps for a high school student, maybe a split session might work in some way or another. Hopefully a little bit more responsible to be able to work on their own after receiving the instruction in school. I mean, I don't know that that is the solution, but I think we have to make sure that we are looking at the fact that different age level, different grade levels cannot be treated in the same way. We have to be thinking differently about that.
Let me just pursue that a little bit. Who should be making this decision? Should this be a local district decision? Should we be expecting some strong rules from the state about this?
Andy, one of the topics that we've talked about at the RESC Alliance task force is, there should be guidance from the state, obviously. And that should be kind of the overriding kind of policy guidance that districts or regions should take. But there have been questions, should this be some regional decisions? Because, there are topics to say, would one region be different from another in their reopening, and how would they deal with that? And I think some of it goes back to the superintendents. I mean, who knows best of their districts and the area, but the superintendents in their own region to coordinate their efforts. And I think Jan brought this up already, that some of those are already happening, where superintendents are getting together as a region and discussing some reopening and what that might look like. So it might be different from region to region, but I think overriding guidance from the state is necessary, but to give some kind of latitude for that to occur, because it is different from a Hartford to, like a Colchester or a Lebanon where I live. There are differences there that, could play into that and how things look.
Okay, so next question. We know that all students have lost educational opportunity during the time of school closure, but we also know that students with disabilities are disproportionately affected by the school closures. I'm asking you to address how we are going to make up for the services that these students have lost, what your thoughts are, your proposals to help remediate the lost education for students with disabilities.
So I guess I'm still unmuted, so I'll take first crack at that one. Yes, between our students with special needs and our students that are in communities that simply never have had the resources, don't have the resources, and aren't likely to get the resources in the future, those are huge, huge issues. And I think it's going to mean that our teachers are going to have to be as on the job and professional as possible to try to say, where are the students right now, and what do I need to do to begin to, for lack of a better term, catch up? And that is going to be a tremendous, tremendous job. It's going to be something that, again, hate to sound like a broken record here, is going to need additional resources for teachers to say, this student needs some individual help, and it needs to get done quickly rather than sometime in the middle of the year. So for us, I think it's all about relying on teachers to assess where their students are, and then figuring out what we need to do in order to move that student forward to the best of our ability. In my humble opinion, I'm not sure we're going to catch up the students' loss over the last few months in just 1 year. It's going to take a while, and it's going to be something that is extremely challenging for our teachers.
And Jeff, to your point from earlier, before we can even begin to think about the academics, we have to assess where students are emotionally. Are they well? Do they feel safe? And I think that it will be really an important activity to make sure that we are assessing that right at the start, and knowing where they are there, because it's about readiness to learn. And obviously, if they're not well there, then they can't be ready to learn. We can try to pour lots of things into their heads, but it won't matter if they're not there. I think that in our district, our social workers and psychologists, counselors, All of our PPS staff certainly has been doing a lot to conduct, outreach with parents and families, and trying to modify from just computer-based instruction to packets for those where that works better, and sending things home and getting things to them. But of course, then it relies very much on the family's ability to be able to support that, because we certainly have been relying a lot on our parents and older siblings to help us and to serve as assistants. And not everyone is able, because maybe they're first responders, or they are, they cannot give that time. And so really knowing how the kids are feeling, especially the kids who are dealing with anxiety, and we assume that there will be some new ones that we are not aware of, that'll be the important first step in catching up.
I think, and this has been a topic also we've been talking about for the past couple of weeks as well. We know that kids have regressed. I mean, let's just put that into perspective. I mean, it's just not the same. I think part of it has to be individualized. We can't say for all students it's significant. Part of it, I think, has to go back to what programs did that child have prior to March 15th, when things kind of closed down. Were they making progress? Was the program productive? And if it was, then there may be some remediation that may have to occur. If it wasn't, then that should have been taken up prior to, the closure of school. But I think going back to what Jeff said, I think part of it is looking at when schools reopen, what that might look like. And we know there's disparity from across the state, from what students are getting. I mean, that's been common, and we know it's there. And I think it goes back to resources. It goes back to individual, whether or not PPTs need to occur again, whether plans need to be revised. But more supports are probably going to be needed, and what that might look like may be different from student to student. But if the supports are there, whether it's extra supports, whether it's more services within the school day, what staffing might be available, and what monetary resources may be needed for that to occur. And Patrice brought that up. I mean, I think part of it is, when we talk about funding, and I'll just relate back to where I live. Is I'm on the Board of Finance in my town, and the Board of Education is looking at a $200,000 surplus. Well, the reason for that is numerous. I mean, one is, because of sports, but again, that's a surplus now that, but it's not going to be the same next year. So, they're going to need all the resources that they can have. And as Jan said, part of the CARE Act, towns like Old Saybrook, towns like Lebanon, are not going to see significant money coming in from the CARE Act. So those are the resources that the town has to consider themselves.
Jerry?
I think that all students should have a universal screening to determine the return to school readiness. They should be screened in health, social emotional status, academics, as well as some sort of interview or debrief about the effectiveness of distance learning. Students with disabilities should have a PPT meeting to discuss the results of the screening. And if the screening shows marked change in their levels, then the student should be reevaluated under IDEA, and their program should be revised. Schools have to be ready for students, and professional development will need to be mandated for teachers in trauma-informed approaches to reduce any potential disciplinary classroom exclusions of minority students, and to prevent misidentification of students as needing special education for emotional or behavioral issues when something else is really at play. And further, the teachers and the staff, other school staff, may need emotional support, since many of them have suffered trauma during the period of closure as well. Schools have to recognize that even though schools will, or may reopen, some students may not be able to return to in-school learning due to health concerns, especially those who are medically fragile. And because of the potential viral exposure that being in school would afford them. And there's also issues with the health concerns of a vulnerable family member. Our students tend to be the stealth vectors of COVID transmission. And so you might not even know that a student has been exposed to coronavirus, and they come home and they can infect, a vulnerable family member. So some parents will just say, we're not sending our children to school. Schools should not respond with DCF referrals and the like. And schools should simply continue distance learning for those families. And some students may not be able to effectively participate in classroom activities because of the social emotional issues or a deterioration of social skills over the time of closure. And provisions should be made to develop plans to reintegrate those kids into the classroom while providing distance learning in the process. And schools need to redouble engagement efforts to ensure that all students remain in contact with the school. There are some schools where kids are just not at all engaged, not receiving any learning, and schools may not even be aware of where those kids are currently located due to housing insecurity issues.
So one question that keeps coming up both on the chat and in questions to the panelists, and it's kind of a similar concern for very young children, as well as children who have significant disabilities who may not be able to practice social distancing, or for sensory issues may not be able to wear a mask or participate in the kind of activities that are being recommended by the CDC and others to keep our buildings safe and clean. So one thought to put out to the panel is whether we can use some of the time that families and educators are still home to start preparing those students in some way for being able to participate in school with a whole new structure.
I think social stories could be written about wearing masks, especially for those students with autism and sensory issues. That's, one effective intervention. And perhaps from an OT perspective, the sensory issues, like there needs to be some sort of desensitization to wearing a mask. And there could be, various programs, whether OT or behavioral programs, about mask wearing that incrementally builds the, the ability to tolerate wearing such a mask.
And I know schools in other countries have done things like prepare videos for families so that they would be familiar with what the new protocols would be, and also prepare versions for the students of various ages so that they would develop a comfort level of what school would look like when they go back.
I think we're all kind of moving around this idea that, and we sort of haven't mentioned it, at least I don't think we have right now, we've got to figure out a regular testing program of students who and faculty who might be carrying the virus, et cetera, and will that be available? And then getting to the point of some students who may need a different kind of contact level. I mean, we're going to have to think about PPE stuff in schools as well, because if we don't, we're not going to be able to meet those students' needs. So, the idea of figuring out who's coming to school healthy, who's coming to school not healthy, or with the virus, making sure that parents understand that if a child all of a sudden begins to exhibit symptoms, they may have to be sent home. I mean, there's not going to be we can't have 20 people sitting in the nurse's office waiting for school to be over, for example. So And then that brings me to the fact that, you know, the burden on our nurses, I think, this year is going to be greater than it ever has been. I've been in this business over 40 years, and clearly nothing is going to be like it's been for those 4 decades as we open up school in the fall.
Do we have a nurse issue coming up?
I think we have multiple issues. Someone was alluding earlier to professional development, you know, for teachers, trauma, and I think for nurses, there's going to be some additional training needed for them to deal with potentially sick children and staff members, but also to be advisors and helpers for staff members who are feeling anxious, or for students who are feeling anxious, and being able to assuage some of those fears. I think we already have a nursing shortage, and I know that we already are finding it difficult to find people. And my gosh, I'm thinking that people who are close to retirement age, no matter what their profession is, nursing, teaching, administration, this may very well be an additional wrinkle in all of our planning, that we may be looking for staff everywhere.
Yeah, not to point a negative thing here, but I know our retirement seminars that we've been doing virtually have been filled, every single one, and we've had to schedule additional ones. So I'm sure that issue is on the minds of some folks, and clearly it's very understandable. Are you going to bring yourself back to school, possibly end up in a hospital or worse, when in fact you know, you may have to just say, I'm done. And that's going to create its own problems, because now we're going to bringing in younger teachers who don't have the experience to deal with some of these things. It's going to be one interesting school year.
Just to add to that too, and I think staff has been a topic of conversation the past couple of weeks as well. So Andy, you brought up a good point. You know, if we're going to, you know, try to do, look at the health, social, emotional well-being of students, then, you know, obviously we've discussed in many of these topics, additional staff, whether they're social workers, whether they're nurses, you know, and at some point too, I mean, depending on the needs, and we go back to the question, you know, of how do we remediate special education students who have had significant regression. I mean, we may be looking at additional tutorial staff as well. I mean, you know, those are all plans that need to start to be formulated. And so when I talked about, you know, guidance from the state and, you know, individual plans that districts are starting to formulate, I think a lot of it sometimes has to be school-based, because, you know, they're going to know the needs of their schools more so than anybody. And there has to be, everyone needs to be involved in that. You know, there should be others involved in that process. And I'll go back to that. I think families need to be involved in that process at a school level, because, you know, again, they know their child the best and can help in that process. But, you know, there's still so many unknowns at this point. And even the plans that we talked about this afternoon, you know, the 3 models that were presented, they're all comes with significant cost, you know, and I think that has to continue to be out there. There's going to be significant costs that have to be looked at from town to a town level and a state level as well. And there's going to be more support that's needed in order to, you know, meet the needs of our students. You know, and again, I know we're talking about our special education students, but, you know, obviously regular ed students coming back, you know, to some extent are going to have some of those same issues and needs. You know, especially in the social emotional area, that in their own anxiety that may not have been identified, but may be exasperated when they return. Because I think people are going to be nervous coming back, staff as well as families as well as students.
Patrice McCarthy is the lobbyist on Capitol Hill in Hartford who knows more about the legislature than anybody else I know. So, Patrice, where's this money coming from?
Well, we all know that we have a significant state budget deficit, but these 2 things are definitely linked, making sure that we can support our public education system and getting our economy back working again go hand in hand. So we have to look at this as an investment. It's an investment in our young people, but it's also an investment in the future of our state. So that message to our governor and state legislators will be very important, because as everyone has said, we know that there are significant costs involved in this process of reopening, whatever that looks like. And if we don't have the resources, we're not going to be successful.
Let me raise a sort of touchy subject here. We continually hear from school districts that we could do a lot more things, but union contracts prevent us from doing it. On the other hand, so let me ask Jeff first. In terms of these hybrid models, are they possible under existing union contracts? And let me ask the rest of you, Jen and Patrice, how much of an obstacle does union contracts play in implementing a hybrid teaching model of the types we're talking about?
So thank you for letting me start out, and hopefully I can use up the rest of our time to make sure that, no, I'm only teasing. We have, from the very beginning, we have reached out to our local leaders, we've reached out to our staff to say, you need to have a conversation with your superintendent and your Board of Education to try to make this work as best as we can develop it, as best of the resources that we have moving forward. So from my point of view, we have already shown, and we will continue to show, that we will look at flexibility here and make sure that we are doing the best that we can for Connecticut students. That doesn't mean that teachers can be in front of whatever for 10 hours a day, but it does mean, because they need time to plan, they need time to correct and so forth. But it does mean that I am more than certain that our local leaders and our staff are ready to sit down with folks and try to work out plans that don't have people going crazy, but are meeting to the best of our ability the needs of students in our schools. And I a little bit off the topic here, but I just want to get it in. I would remind you that presently in Washington, D.C., there's a $3 trillion plan in front. I'm pretty sure it's not going to pass both houses of our legislature and get signed by the president, but we've got to do more than we've done so far. There has to be more response from Washington, D.C. in order to get this school year off and to be able to meet the needs of our students in our schools. And we'll be willing to work with administrators, boards of ed, and say, how can we make this work so that it's working for students, but it's also working for the educators?
And I would just add that boards of education have seen over and over the commitment of their teachers to their students, especially in these challenging times. And I think that when there is a spirit of collaboration and a focus on the needs of the child, just like in the special education process, the same is true in looking at contracts and making revisions where they might be necessary. If that collaboration and the focus on good education for all students is there, I think we'll be able to reach those agreements. And we know that teachers are key to the well-being of our students, their emotional needs as well as their academic needs.
I think that I would just add to both those comments that there is absolutely nothing in our collective bargaining agreements that prepared us for this situation. They weren't written for this. They didn't contemplate this. And so that's a problem. However, it's not a problem that we won't be able to overcome. I have watched teachers step up in ways that, are just remarkable. This is exhausting work they're doing. Being a teacher, doing this, as I say all the time, if you're doing this job right, you're tired all the time. And being a teacher right now is very tiring because they are that terrible feeling that you have when you're in your first year of teaching of being one page ahead of the kids. I think they feel like that all day long, every day. Some days better, some days not so much, but they are putting in the work that's needed. I think there's going to be a lot of discussion. And again, everything comes down to relationships. You know, if you have great relationships, teachers and administrators and boards of education, then we can move things forward. Yeah, it will be incremental. I don't think it's going to be one fell swoop. I don't think you're going to see memorandums of understanding and collective bargaining agreements, you know, being produced at a rapid pace. I think it's going to be incremental as we begin to absorb over time collectively what it is that we're in for, because we're still doing that, all of us. I think we're all still all absorbing, you know, where we are, how we got here, and what the future might look like. But I do think through lots of hard work and lots of communication, regular communication, which I highly recommend to all my fellow superintendents who I'm sure are doing it, you know, regular meetings with leadership of teachers unions, locals, really, really important to move things forward. But we can get there. I believe we can get there.
So I'm kind of going to try to summarize some of the lines of questioning, to use a lawyer's term, that are coming up on the chats. There's a lot of concern here and elsewhere about the idea of a phased in or staggering of a school week based on age, based on high-risk groups, et cetera, for a number of reasons we've already identified for both the teachers and the families in terms of their ability to work and parent and all of those things at the same time. But there are a number of questions that have come up about the safety of older or vulnerable for medical reasons teachers and educators. Has there been any thought about pairing up some of the students who really maybe should not return for a number of reasons with some of the teachers who maybe should not return for a number of reasons to the actual building if we are on an extended period of closure?
I'd be happy to start with that. I think that parents, families, all of us wearing that hat, the disruption to our lives has to come to an end. So those of us trying to get schools back open again, we understand that. And again, going back to my original point about answering the question about my three biggest concerns, number one being safety of students and staff, those two things seem diametrically opposed. So I do think that we're going to have to come up with a plan that keeps people safe, but still allows people to have opportunities. So to answer your question, Jennifer, I think that we may very well come up with creative ways that some students who are staying at home are working with teachers who are unable to be in the building. One of the hybrids that the state has proposed is everybody's pretty much at home, but they can come into the building. Well, what if the opposite were true? What if we found some ways to, at some point, have students and staff in the building if they are comfortable, able, and you know, and well enough to be there, or their family situation allows them to be there, and have a hybrid where some students and some staff primarily stay home. I'm not suggesting I have all the logistics worked out to that, but I think that's worth exploring. And actually, I won't even take credit for that idea. That actually came from teachers in my district.
Let me ask about, are we on schedule? I mean, we have 3 months to go, and there's a huge amount to deal with, and we have no greater certainty today than we had 2 months ago about this. Is this doable? I mean, what could the governor or the Department of Education do now to make it possible to create a hybrid learning system starting September 1st?
Since they can't wave a magic wand and give us the medical certainty that we need to know exactly what course of action would be most prudent, it's to make sure that districts have the resources that they need to pursue these plans, whether it's resources for professional development for educators and nurses and administrators, whether it's resources to allow for more individualized instruction so that we can assess where the learning gaps are for all of our students, or resources to make sure that there are counselors and social workers available to provide that social emotional support for students and staff.
Andy, I think part of it, going back to some of the models that we're starting to see, one of the tasks that's been assigned to, the Rescue Alliance is to start to look at, as well as some of the other, task forces that are working, is to give feedback, to give some, comments back to the larger group, to the commissioner, looking at the models, looking at differences, looking at cost factors, and then coming up, as Patrice says, what are the resources that might be necessary. But I also think, and you're right, I mean, it's still the unknown. We don't have this specific guidance. I mean, we've gotten some today or yesterday for summer school, but I'm not sure how realistic that is. But I like even what Janet said. I think part of it is giving options, as I said before, where if there's guidance from the state, then let's start planning and coming up as a, whether it's by region, whether it's by district, but start to plan on what those options might look like. Because we know school's going to reopen at some point, and what that might look like may be different. But we need to start planning. And yes, we have very little time to do that. But at least the process has started. There are planning, there are, people are talking. You and I are both involved with the things from the Bureau of Special Education, looking at some of the special education issues that are being discussed. So people are talking, and we may not have all the answers or the solutions, but at least we're trying to formulate some of that guidance.
Andy, what is the possibility of the HEROES Act actually being passed? And is there anything that parents can do, or are there any sort of collective state, activities, like governors getting together to say, hey, we need this money for our schools, and school opening and economy are inextricably tied to one another, and if you want the economy to open, you need to open schools and provide schools with the money that they need, et cetera. And is there any sort of effort from governors to, or is there another model for lobbying efforts to get the HEROES Act passed?
I do government relations for our national organization, so I have some competence to answer this question. I would put the chances of the HEROES Act passing at about the same level as the chance that we have a vaccine this year. Very small chance. The president and Leader McConnell are both on record and strongly opposed to it. And moreover, the HEROES Act doesn't really earmark the money for education either. We need, specific money earmarked for reopening schools and for special education, and that has not happened as yet.
I think there is, I can't remember the amount right now. I know at one point our national organization was looking to try to put $175 billion into education funding across the states. I don't think we're there as part of the HEROES Act right now. I think it's less than that. I can't remember the number right now. And I agree, the act as it is right now is not going to make it anywhere. But if nothing comes of it, we're in trouble. We're in trouble already then, because we aren't going to be able to do, as has been pointed out over and over again, states can't deficit spend. So we've got to get the money from Washington, D.C. And if we get no money from Washington, D.C., I think we're in for one tough time. But if we can get at least something, some form of money, and some of that HEROES Act money will go to at least states to do other things. I mean, there's other heroes besides teachers here to make sure that our economy and our society continues. So I'm hoping that something comes out of that. The full $3 trillion, no, I'm almost, I'd bet that's not going, but we need to get something out of Washington, D.C. in order to move through next year, without a doubt.
So
Are you developing plans for doing a hybrid education system in September if there is no new money?
Yes. Yeah. Go ahead, Jeff.
Go ahead.
Yeah, I think we have to. I think that anyone who's being prudent at this point is developing multiple plans for school for the fall. We have teams active at the district level working on multiple versions of what education is going to look like in the fall, and then all of the accompanying work that goes along with it, like what will the medical support look like, and what does the transportation look like, how much staff will we need to do that. I think that we have to do that. I think we're also doing that as a regional level. As Dave said, I'm part of my region's recovery team as well. We're also doing it in my community at a municipal level. And I think that it takes that sort of teamwork to be ready. To your other question about can we do this? If you're going to be ready, you need that level of support and that level of networking around you.
So to sort of merge two themes that have come up in the questions, one is the issue of the use or changing of the use of resources that have been previously allocated for in-person education like paraprofessionals, as well as the issue of having some time period before the buildings reopen whereby we can prepare everybody for the start of school. I'd like to ask you to respond to the idea of using paraprofessionals to assist families in getting their students ready to begin to attend school again during the time period before it opens.
Kind of a broad question. I'm not sure. What do you mean by preparing families?
So as we talked about, certainly for our population, there are many students who may not be ready to go back to school and follow the protocols, the health protocols that would be in place. We've talked a lot this evening about the social emotional piece for many of the students who either before the closure or since the closure have developed anxiety around these issues or perhaps some school phobia. And so the question is whether we can use some of the resources that are already tabbed by districts during the time period before the schools reopen, such as paraprofessionals, to assist families and teachers in getting kids ready for school, since the kids are still going to be home before the buildings reopen.
I think the paraprofessionals are key to this, and I think we have to make sure that they get the training that they need as we enter into this uncharted territories as well. I know that every teacher that I talked to, and when I was a teacher in school myself, those paras, those other educators are so important to the process. They need to be well trained as teachers are, and they need to be ready to step up and help in any way they can. I even think in a nice imaginative way, we might think, for example, of some of those folks in teacher education and social work education schools who are towards the end of their schooling. Maybe we can say to them, you know what, we could use your help. What a tremendous training that would be as we begin under the direction of a trained educator. Maybe we need to be able to look at those and say, can these folks help us a little bit as well? I know enrollment's down in many education schools, but the bottom line is maybe we can find a way to use that resource as well.
You know, and what Jeff said, I mean, it goes back to some comments I made before. You know, it really goes back to the planning that the districts or the regions are utilizing, and paraprofessionals are a resource. I mean, obviously, and they should be utilized as a resource. So part of the planning is that the school feels that students need some of that transition planning to return. Then obviously, if paraprofessionals are available, they can certainly be used to help that process. But I don't think, again, you know, we should generalize. I think it has to be based on the individual needs of the students, and it's it's a requirement, not a requirement, but it's up to the schools to start to look at that. You know, where can paraprofessionals fit into the planning for kids to return? And if that means a resource for families, then obviously I think that's a good idea. but it needs to be part of an overall plan.
Anyone else want to address that or? Nope. We're coming up on just over an hour, I'm reminded. So we have gotten so many questions from our viewers, which is really fantastic. And many of them we've tried to answer, but as I've posted, and I think others, we are keeping track of them. We will try to answer those that we haven't been able to answer tonight on Seek This Week, Thursdays at 7 p.m. on our Facebook page for Seek. And I can't thank the panelists enough. We greatly appreciate not just your thoughtfulness and the time that you've been giving. We know not just on this panel, but on many others. And task force, I say to my colleagues, I can't keep track at this point of all the task forces and focus groups and various panels that we're all sitting on these days. Our hope is to brainstorm with you. Some good ideas have come out of this. We at Seek are working on a paper to submit to have and offer some proposals that take into account the concerns we have about our students with disabilities. But we can't thank you enough for doing this very much. Andy?
I thank you too. And one of the really big benefits that we've gotten out of this closure is that we are all working together, which was not something that was necessarily the case before this happened. And let's keep that going. Thank you very much.
Absolutely.
I think that's the end of,
And thank you.
end of the webinar.
I enjoyed it. Thank you for asking me to participate.
Yes, thank you.
Thank
Have a
you.
good night, everyone.
Good
Thanks.
night.
Everyone have a good night. You take
Good
care.
night.
Good night.
Stay well.